Hello everybody, Dr. Peter Chahansky here, health optimization practitioner. I'd like to do a follow-up on a video I did a couple of days ago regarding the immune system. Apparently our leaders, specifically Dr. Anthony Fauci, is not talking about this and giving us guidance as to what we can do today to be healthy tomorrow and for weeks and months and years to come. Because after all, he is saying that this COVID-19 is going to go in different phases and there's going to be another outbreak at some point in time. So wouldn't you rather bolster your immune system now so that you can be prepared for what's to come in the future? And, like the flu is seasonal. We get it every year. They're trying to put together a vaccine for COVID-19. Just to let you guys know, do your research, but coronavirus has been around in many different strains for hundreds, if not thousands of years. And there has yet to be a successful coronavirus vaccine. So I'm not holding my breath currently, and I don't think you should either. I think if you bolster your immune system, even if you're exposed to any of this stuff, then you will have antibodies built up. You're basically putting antibodies into your body because your immune system is doing the job that some paid mercenary, which would be a vaccine, would do. I mean, take the flu shot. Has the flu shot eradicated the flu? Not last time I checked. So they will tell us every year that we need to get a flu shot because, there's a different strain. This coronavirus is not going to be any different. And not only that, how effective has the flu shot been? This past flu season, 20% effective. The prior flu season, 10% effective. So if your immune system is bolstered, you don't have to worry about any of that stuff. Today, what I want to talk about is I want to call out Anthony Fauci for not educating the general public as to what to do. We've been told that there's going to be another round of this sometime in the fall, maybe in the winter. So, let's bolster our immune systems, create our own antibodies, because when you are exposed, like a lot of people already have and don't even know it, haven't had symptoms, well, then you're going to build antibodies, and that is an instant vaccine. Okay, so Anthony Fauci was talking about what to do. Back in 2016, he was interviewed, and in his article, How to Avoid Getting Sick When You're Around People All Day, he talked freely about vitamin C, and as a matter of fact, he gave his own personal recommendation for what he takes daily. He takes 1,000 milligrams a day. He even talked about vitamin D. So why isn't he talking about that now? You got me. But anyways, so let's talk and spend some time on vitamin C, because vitamin C, as you'll find out, is going to be extremely relevant for this specific issue that we're now under the influence of. So why is vitamin C so important? First of all, it's an immunomodulator, okay? And it stops something called the cytokine storm. And we're going to get into that a little bit because that is what is killing a lot of Americans and people worldwide, this cytokine storm. They get put on a ventilator, and if you've looked at the statistics, only 20% of people put on a ventilator survive, okay? And it's all due to this cytokine storm causing something called ARDS, acute respiratory distress syndrome. Vitamin C is also a powerful antioxidant and an anti-inflammatory. It helps to take a viral it's antiviral, and it disrupts viral replication. And I already explained in the last video what that means. For any virus to get you, we talked about the COVID and what it looks like, and it's got the spikes on it, and those spikes are keys, and those keys need to fit into a lock in your body on your cell. And when they fit, then they can empty their components into your cell and cause your DNA to replicate that virus. That's how these viruses survive and overtake your system. So let's first talk about the immunomodulation part of it. Immune modulation. That means it modulates your immune system to bolster and strengthen your immune system. Okay? So vitamin C is an antioxidant. What it does is it scavenges viral-induced oxygen-free radicals that are damaging to the cell. And it helps restore normal oxidation and oxidants that are supposed to be there. Okay, so it's also anti-inflammatory, and it's the anti-inflammatory side of it that it stops these this cytokine storm.
Surprise! Here I am. I'm at the beach. Beach is open today. So, you know what? Let's talk a little bit about this cytokine storm. And, you know, we talked about it. The people that are most compromised with their immune systems are the ones having a lot of trouble currently. And basically, if your immune system is not firing on all cylinders, you will not have as many infantry at the front lines fighting whatever is attacking you, whether it's this virus or any other. And you will have less weapons and less soldiers to fight that enemy. And so because of that, they will fire indiscriminately, causing collateral damage to your own tissue and to your own cells, creating an inflammatory response that is causing the big problem as we speak. We have these little alveoli in our lungs. This is where air is exchanged between the lungs and the blood tissue and the blood vascularity, And so the fluid builds a buffer between the lung tissue and the circulation and doesn't allow the oxygen to penetrate, causing this acute respiratory distress syndrome, ARDS. So that's the big problem. But currently, right now, I'm making plenty of vitamin D, which is making my cathelicidins. Remember, we talked about cathelicidins, and that's the bullets for the muskets. I've gotten plenty of vitamin C today. My immune system is firing on all 12 cylinders, and hopefully yours is too.
So that's what vitamin C does, is it stops the antioxidant side of the viral, creating an antioxidant problem, as well as the cytokine storm, which is the inflammatory side of things, so that we can breathe. And this is why people get put on ventilators. And we already talked about the statistics. Once that happens, you're already severely ill with acute respiratory distress syndrome, and only 20% of these people survive. So we don't want to get to that point, and vitamin C is our big friend in helping us to accomplish that goal. There are numerous papers published with using intravenous vitamin C, especially when somebody is already in acute distress and they only have hours to live. There was one case of a medical doctor who contracted COVID-19 while treating patients, and he only had 24 to 48 hours, according to his fellow physicians, to live. He was on a ventilator, and so they pulled out all the stops, and they actually gave him, this was in the LA Times just recently, they gave him high-dose intravenous vitamin C along with another immunosuppressant drug. And he literally pulled out of a near-death experience and survived. And so there's numerous papers out there. There's numerous cases of using this. Unfortunately, hospitals will not use it as a protocol. And hopefully now that some of these cases are being seen, that will change. There's another protocol that is called the Merrick Protocol. And I learned of this protocol from my mentor, who's a neurosurgeon, and he taught this to us about 1.5 years ago. And basically, this Merrick Protocol consists of high-dose vitamin C with thiamine with a pulsed hydrocortisone IV. And this is used for sepsis when somebody is near death, especially with what's going on now, people on ventilators are near death. As we see, 80% don't make it. So this is a protocol that has been used for years. So that's a little bit more in depth about vitamin C and why it's so important with what's going on today and what Anthony Fauci should be talking about. Let's be proactive and get out there and bolster our immune systems and stay and be healthy. All right, guys, have a great night.